discuss pregnant woman complaints of vaginal bleeding. There are many possible causes: abortion, threatened abortion, inevitable abortion, incomplete abortion, missed abortion, septic abortion, or ectopic pregnancy. This may be undisturbed ectopic or disturbed ectopic or chronic disturbed ectopic, or pregnancy in rudimentary or abdominal pregnancy, or molar pregnancy, complete molar pregnancy, or partial molar pregnancy, or a complication gestation of plastic neoplasia. So the first thing, we have to shake the hand of the patient and introduce yourself, and then we ask the patient about what is your name and how old are you, and then what is the nationality, and what is the social status. And if she has pregnancy before, we have to tell how many pregnancy and the outcome of this pregnancy, and if she was using a method of contraception, we should tell. And what is the blood group, and what is the RH typing, and what is her job, and where they live, and then she has special habits: smoking, alcohol intake, or narcotics. And if she is smoking or not, and if she is smoking, how many cigarettes per day, and for how many years she is smoking. And then we will know the main complaint of the patient, that the patient has vaginal bleeding and she is pregnant. So what is the first day of last menstrual date, and then she is sure of date or not, or she was using hormonal contraception the last 3 months before this or not. And then we calculate the expected date of delivery, and we can determine the gestation age of the patient, how many weeks this patient is pregnant now. We can get some information about symptoms of pregnancy: nausea, vomiting, or nausea, tenderness, tendency to sleep, fatigue. And if she has any investigation to ensure this pregnancy, whether pregnancy test on urine or blood or ultrasound. If she has an ultrasound, what is the result of this ultrasound? If she has vaginal bleeding, when this bleeding start, and what is the cause of the bleeding? The bleeding is continuous, or is increasing, or decrease and then increase. Bleeding severe and then stop. Bleeding was mild and heavy and then trickling, or bleeding was moderate and then stop. And what is the amount of the bleeding, minimal or severe or pernicious, and for how long she bleeds, for days or hours, and what is the color of blood? Is fresh, and fresh become brown and then again, or brown blood, or brown then become red, or prune juice. This we ask if the patient has attacks of falling or not. Is there abdominal pain or not? If there is abdominal pain, when the pain starts, bleeding starts, then a pain, or the pain precedes bleeding, or pain and then bleeding noticed together. And what is the type of the pain? Is colicky pain, or dull aching pain, or stabbing pain, or stitching, or heaviness? And the site of the pain is lower abdomen in the center, on one of the iliac fossa, dull aching pain, or pain on side, flexing hip, or back pain, or dyschezia, or shoulder pain. If the pain is radiating to the back or to the lower limb or to the back of the shoulder. Then we ask the patient that she notice passage of any product of conceptions, nothing or tissue or sac or fetus only or fetus and placenta or vesicles. And then after expulsion, the bleeding stop or the bleeding comes severe or bleeding continues. If the patient gestational age is more than 12 weeks, we can ask that the patient has gush of fluid or not, trickling of fluid, and then we ask about if she is feeling fetal movements or not, and what the fetal movements she is feeling up to date or not. We ask about the patient has noticed that she has a rise of temperature or and we will ask the patient that she has previous attack of bleeding or this is the first attack or she has several attacks of bleeding. And what the investigation has been done to know ultrasound will show interstitial gestational sac or collapsed sac or empty uterus or intrauterine sac with fetal echo, intrauterine sac with living fetus or large empty gestational sac, or case of ectopic we may find that the ultrasound was empty uterine cavity or empty uterine cavity and fluid in Douglas pouch, or empty cavity with diffuse blood in peritoneal cavity, or empty uterus and adnexal swelling, or empty uterus and gestational sac outside the uterine cavity, or empty uterus with living fetus outside the uterus. Case of molar pregnancy, we may find that ultrasound with no storm appearance and no fetus. We can ask about the past statistic history about severity, and then she has problems during pregnancy, and then we have about postpartum complications. When you take an obstetric history, you can take all the data when the pregnancy occurred, in which year, and then the duration of the pregnancy, and then any problem occurring during pregnancy, and when the pregnancy ends on a portion of delivery or a pregnancy. If it's a case of delivery, we can spontaneous delivery, breech, reduced delivery, and cesarean sections, forceps, and the newborn outcome is male or female, living, and how many kilos, and any postpartum complications. And also we ask about any neonatal complications or admission to incubator or sepsis or herpes palsy or neonatal injury or congenital fetal animals, and then we ask about the breastfeeding, is yes or no. And post-surgical history: operation appendectomy, brain cystectomy, laparoscopy, or cesarean section, and past family history of hypertension or diabetes, or neonatal history or twin congenital fetal animal. Then we are going to examine the patient. Patient's general condition: normal, severe, or pallor or drowsy, and the pulse and blood pressure, and we should correlate the relation between the pulse and the blood pressures, because the marked tachycardia and of the blood pressure and the bleeding is minimal, so there is possibility of internal hemorrhage, so the temperature is normal or not, and the respiration is normal or not. Then we examine the patient's abdominal examination. In case of abortions, the size of the uterus is equal to the gestational age after 12 weeks, or less than the gestational age, or more than the gestational age. In case of ectopic, nothing is felt by abdomen, tender one of the iliac fossa, or tender swelling on one of the iliac fossa, distended abdomen with blue discoloration of the umbilicus, or fetus is easily felt under the abdominal wall. In case of molar pregnancy, the size of the uterus may be larger than the gestational age or equal to the gestational age, due with sensation, and no fetal heart sound can be detected in case of complete mole. Then the vaginal examination, we look for there's bleeding, and the bleeding severe or moderate or mild, or there's brown discharge, vesicle or tissue and bleeding of fetus and cord of the placenta or the placenta. And we should do speculum examination, so the cervix is seen no bleeding, or cervix with brown discharge, or fresh blood from cervical canal, or sac of the breast from conception sequence, cervical canal, or fetus is coming from the cervical canal. Case of digital examinations, case of molar pregnancy, the cervix is soft and may be open or closed, and then sometimes inside the cervical canal may be product of conception. While in the case of ectopic pregnancy, the cervix, there may be tenderness or moving the cervix. In the case of molar, the size of the uterus by manual examination is equal to the gestational sac, or less than the gestational sac, or more than the gestational sac. The gestational sac is more than the gestational, and then the adnexa is free or tender, or left ovarian swelling, or tender right ovarian swelling in case of complication of ovarian cysts, whether hemorrhage or rupture. In case of pregnancy, it may be associated with pregnancy and complication of ovarian swelling. And then we look for the Douglas pouch, that is free. And while in case of ectopic, by manual examination of the uterus, it may be normal or slightly enlarged, and the adnexa may be tender or tender swelling of one of the adnexa. And then the Douglas pouch, sometimes it is either free, or there is big marks on Douglas pouch due to collection of blood. The ultrasound has a very important role in the case of abortions. The ultrasound may be in just endometrial sickness and no second side, and if the disturbance occurs very early, or when there is intrauterine gestational sac, or collapsed sac, or empty uterine cavity, or blood inside the uterine cavity. In case of complete abortion, intrauterine sac with pulsating fetal echo, or intrauterine sac with living moving fetus, intrauterine sac with dead fetus, remnant of pregnancy inside the uterine cavity, or placenta is inside the uterine cavity. In case of ectopic, we may endometrial sickness and no sac inside the uterus, or both blood inside the uterine cavity, or empty uterine cavity, or empty uterine cavity with blood in Douglas pouch, or empty uterus with adnexal mass on one side and free fluid in Douglas pouch, or empty uterus with gestational sac inside seen outside the uterine cavity, or empty uterus with gestational sac with living fetus outside the uterine cavity, or empty uterus with dead fetus outside the uterine cavity, or empty uterus with collected blood in the pelvis, or empty uterus with free blood in the peritoneal cavity, or empty uterus with blood collection in the broad ligament, or living fetus inside the rudimentary horn with fresh blood in the uterine cavity, or empty uterus with living fetus inside the peritoneal cavity. While in case of molar pregnancy, we may see that snowstorm appearance and no fetal tissue, or living fetus with multiple equiescent spaces inside the placenta in case of partial mole, or dead fetus with multiple equiescent spaces inside the placenta, or empty uterine sac. وبكده بنهاية examination and history, you can suspect the possibility of the diagnosis of patient have bleeding and early pregnancy.